Welcome back to the Quantum Couch. I am your host, Dr. Ina Conboy. Today is a very special episode. My guest is my best friend from medical school, Dr. Michelle Marin, also known as Doctora Marin. She is a board-certified pediatric emergency medicine physician who completed her pediatric residency at NYU Langone School of Medicine and fellowship at the Icahn School of Medicine at Mount Sinai. She is recognized for her evidence-based, patient-focused approach and is attentive to both medical expertise and intuition in caring for children and families. Her key areas of focus include medical education and physician wellness, having been honored in 2023 as Service Educator of the Year by a former residency program. Whoop, whoop. In addition to surviving medical school together and supporting each other through the journey, Michelle and I bonded over our shared love of spirituality and mysticism. I'll never forget the day that her and I went urban exploring in a sprawling abandoned complex in northern New Jersey, once a tuberculosis hospital at the turn of the 20th century, and then later converted into a psychiatric facility. And at the time of our exploration, it was left to decay, its once beautiful walls seeping with really sad energy. At one point, we approached a particular building, and Michelle immediately asked that we leave, sensing a deeply negative presence there. You see, Michelle is not only a very gifted physician, but she also has abilities as a medium. Over the years, she's cultivated these gifts, not just as a physician, but also as a medium through training and practice, learning how to channel and use them with intention. I've always found this aspect of her both fascinating and inspiring. Instead of trading clothes like many friends do, we exchange pediatric and psychiatric advice. Alongside that, we swap recommendations for psychics, intuitive readers, astrologers, and mediums. For years, we've gone to the same Reiki master, gifted each other crystals, oracle cards, and readings. All of this is why I consider Michelle my true soul sister. She's someone who truly understands me on every level as a mother, a physician, and a spiritual being. Today's episode is a conversation between two physicians who are holding space for both worlds, the rigor of science and the mystery of spirit. Dr. Michelle Marin, welcome, my beautiful friend.
Oh, thank you so much for the beautiful and warm welcome. Right back at you, girl. I'm so happy to be here. Thank you for inviting me to your podcast.
I'm thrilled. I've been looking forward to this for quite some time.
Me too.
So let's hop right into it. How do you think your life path led you to becoming a pediatric emergency medicine doctor and also a spiritual person? Easy question, right?
Yeah, no big deal. I could answer it in one word now. It's so to go to the first part, the pediatric emergency part, the best way I could put it is honestly, it's a little bit of a family business. I grew up with it. My mom both my parents are physicians. And I remember when both of them went through medical school, I was alongside mainly with my mother through it, going with her, sitting in the same classroom we sat in like 20 years later, or 10 years later, I should say. Basically like being there, like I remember being a little kid there and walking those halls and then hearing about her days as a resident and stuff and being inspired, which led me to actually volunteer in the pediatric emergency department at University Hospital, where we trained for medical school at NJMS, as a 13, 14-year-old, helping put in IVs, like holding children down, cheering them up. So that all just kind of felt like that was home for me. And it just naturally became my path and naturally where I gravitated to. And it's been a really rewarding and fulfilling career. It's been awesome what I do. I love that I help children in all different sorts of from all different backgrounds and with all different types of illnesses, from very minor to very grave, and just helping the families feel heard and really trying to get to the bottom of whatever ailment kids have. It's a true passion of mine and I love it. And even though it's something that I had that exposure to since I was younger, it's something that feels natural and a part of me. Very similar to the spirituality. I grew up with a very religious family, very much heavy into Catholicism. But also there was a part of it where they would honor the spirit and recognize the spirit. If someone were to pass and there was something that felt like it came from that person at the moment of passing, it was recognized and it was honored in my family. And it was, no one just like kind of poo pooed it. And little things like that, along with just my own curiosity. Like as a kid, being a Puerto Rican kid, we always watch Walter Mercado on the Spanish networks,
Who's
Univision,
that?
with, with our grandparents. Like I would watch my grandma. Walter Mercado is a famed astrologer from Puerto Rico that a lot of people are familiar with. So it was like I had that exposure as well as like to the great beyond and astrology. And, I had my family who was also into astrology, which led me down that path. And just different family members fostered it. Like even my grandfather, I feel like he kind of helped tapped me in there the most when he introduced me to Dr. Brian Weiss and the past lives. And that kind of opened up my eyes in a way that I never opened it up before. And Elizabeth Kubler-Ross, just like that, led me to reading her stuff and learning about that. And near death and just the phases of death and everything like that. And it just kind of all of this built who I am today and what my belief system is.
It's interesting because it sounds like your family was a really big catalyst for both you becoming a physician and also as the spiritual being that you are.
Absolutely. I feel like, you can't help but be influenced by who you're around. And I really feel like, both directly and indirectly, they kind of influenced who I am today. Different members of my family and just what I've been exposed to, they certainly have.
You've mentioned that both of your parents are physicians. What kind of physicians are they?
So, my father is a bariatric surgeon, and my mother is a pediatric emergency physician, just like me. Mm. Or I am just like her, I should say.
And does this run in your family, or were your parents first generation physicians in their family?
So my parents were both first generation physicians. They both were. And my mom and her siblings were the first to graduate college within our family, which is huge. And now it's continued to be passed along my mother's lineage because two of my brothers are actually in medical training. One of my brothers is a pediatric resident, not too far away from you in Philly. And I have another brother who's in South Jersey in his second year of medical school. So
That's pretty incredible.
apple does not fall far from the tree. And then talking religious, spiritual, my other brother is in the seminary becoming a Catholic priest. So
Yeah. So, speaking of religion and Catholicism, can we touch kind of on the subject for you? What is it like for you and your relationship? You said, I mean, we know that you're a spiritual being. Do you have a relationship with Christianity or Catholicism as well?
So for me, I want to take it very broadly. Like, let's take it even a further step back. I feel there is an overlying presence that none of us can explain, but we all that loves us, that's, helps guide us. And it's something it's a presence that's intangible that as humans, we just try to understand and explain what we cannot see. And different people from different areas in the world have tried to explain and create a relationship with this said presence with religion. And I feel that there's no wrong way to express it, and that, there is many ways to express it. And for me, Catholicism is one of these ways for which we can connect to God, universe, source, whatever is your preferred word, for this entity. And my relationship is based on that connection. When I hear the stories, go to mass every once in a while. I'm not a regular mass goer, but I do go. And when I do, I listen to the messages of love, of caring for one another. That to me is the essence of what's important with Catholicism. The principles of what is being an accepting and moral person, in the sense of accepting all. There's a lot that the Catholic Church does that I don't agree with. Um, but I for me, I do not subscribe to that. There's certain things that I just do not like that they do. But for me, I look at the way of connecting with God and the messages of love and the messages of Jesus, of accepting everybody, and of being kind to one another and just being there for one another. That's my relationship with it. Um, I'm choosing to expose my children very slowly to all the teachings of the Catholic Church and of religion in general, because I feel like it can be overwhelming. Because I mean, I was exposed to it from a very young age, went to Catholic school from kindergarten all the way through undergrad. And I think when you're younger, it can be overwhelming. So I'm slowly exposing them to it, and little by little taking them to church and stuff, and kind of showing them like this is a message of love and this is what we need to hear from what is being told, making sure that they hear my side of it. But that is my relationship with it. I wouldn't, I don't have the strongest relationship as others do. I'm not someone who's going to pray the rosary every night or anything like that, but I do use it as a way to connect with God.
Hmm. So obviously this is a pretty big part of you. You're very in tune with the universe, with God in a way, whatever whoever you want to call it.
Hmm.
And you you rely on it quite a bit to be part of your being and how you raise your kids and how you interact with other people in the world. How do you make sense between being a physician with all of the science, all of the evidence based, all of the rigor that goes into being a physician, and then also um, being the person who is shaped by the spiritual side? I mean, obviously, you're not going to bring in and preach about Jesus or spirituality in your day to day work, just like I don't do either. But it is also obvious that both you and I are shaped as healers based on all of these other aspects of our life. How do you make sense of it all?
That's an excellent question. I feel that with medicine, it's both. Not only is it an art, they always say, I feel like I've heard so many of my mentors say, medicine is an art. Medicine, though, is also science and based in rigorous evidence that people have collected over the years and has evolved. And um, there is these kind of, tests that have been able to diagnose X, Y, and Z. We know certain treatments work because of these rigorous multi-level trials that have been done. And then we give these, you know, medications to patients. And for me, this is the most important part of medicine, is making sure we follow the evidence, because we know this is how we really do no harm for our patients because we are following science. We are following what we know it is safe and can work and help patients. So for me, this is what I focus on when I'm on the emergency department. I feel that my soft skills do come in, that spirituality side, more of a sense that every time I go into any shift, I always have a little prayer that I make sure that I can help anyone, any family that comes through the emergency department, that they can be heard and that I can help them to the best of my ability to get to down to the problem. And I always, when I'm taking care of patients, I feel like I bring that in, like listening to parents and how worried they are, making sure I'm not missing things. And there have been times where, like, maybe, like parents will say XYZ and it'll seem like a very straightforward diagnosis. But then they say, but I feel there's something else. And I'm like, you know what? I think you're right, and I'll run that extra test and then I'll find something major. It's like some people might stop there and be like, no, we don't have to do this anymore. Like, I think we're fine here. But I feel like my intuition leads me to go that extra mile sometime to make sure we're not missing something major. And there have been times I've been able to pick up certain things that maybe other people wouldn't have picked up. However, that's the only time I use it. Is like if I feel like maybe I should do a little more, I'll follow that hunch. And it's really helped me in many ways. Just like using it as like a little hunch, be like, or maybe you shouldn't look like a little something inside me, be like, oh, maybe you should examine the abdomen one more time. Maybe you're missing something there. Go back and examine, and I will, and I'll find something, and then I'll find an appendicitis that I was thinking maybe was a meningitis or something like that.
Mm.
And that's the way I kind of am able to meld the two. But when it comes to treatment, evaluation and management, I am following the guidelines. I love guidelines, especially
Well,
from CHOP, from close to you.
yeah, I mean, in your field of medicine, and obviously there are different fields of medicine. Some fields of medicine have more of the guidelines and recommendations than others. Like it sounds like in emergency medicine, and please correct me if I am mistaken about this. In emergency medicine, there's more of like almost like a flow chart. Like if the person comes in with these and these symptoms, then you do this and this and this, and this is based on particular research and like a lot of trials and just observation. I would say in psychiatry, we do have those, but it's definitely much more flowing and a little bit more abstract. There's much more room for kind of uh the art of medicine, but it feels like in emergency medicine, it's much more strict in terms of how to follow, which I think is, and please, is that correct to assess?
Yeah, I would say in general it is that, yeah, we're very much more guideline focused. Like for asthma, status asthmaticus, there's certain steps we are going to follow. There's a certain protocol we're going to follow. At what point will we give IV magnesium or not? There are certain things that need to happen before we do that, or certain clinical signs and findings that we will have before we go to that step. So I would say overall, yes, that there is. Sometimes there's a little bit of wiggle room, but I would say for the most part, it's very much protocol kind of driven work.
So outside of work, what do you do to connect with the world? How do you connect with your own spirituality? What do you do when you're off hours?
So for me, every single day I always meditate. I do different forms of meditation. Right now, I'm very much in my grounding phase. Where I'm doing a lot of like mindfulness and presence meditations. There'll be other times where I'll do other forms of meditation, but this is the one that I've really been into the most, and journaling. I journal every day, like with a gratitude journal. Just in my journal, whatever I'm grateful for, what my goal is for that day, what do I hope to achieve that day, and just like any thoughts. And I draw a little picture. It's like my thing. And for me, that's my way to connect not only with myself, but with the world around me, seen and unseen.
What kind of pictures do you draw?
It depends. I feel like I'm probably at the level of a kindergarten artist. As you can see behind me, I have this art by my now 7-year-old. She did this when she was 4. She has way more artistic ability than I do. I will draw flowers similar to she does. I'll draw like clouds and like sometimes I'll draw little mazes and like little things like that. Eyes. I like to draw eyes a lot too because I feel like it's the window to the soul, which is an actual old Native American proverb. So I like to do that as well. Things like that. Just like whatever I'm feeling, random objects. I'm not, like I said, I'm at best a kindergarten level artist.
Love that. So we introduced you as a hobby medium, and that you have abilities also as sensing energies.
Mhm.
Can you tell us a little bit more about that? When did it start, and how did you develop it further?
Sure. So I want to say that I consider myself still a developing medium. I feel the being a practicing medium takes many years of learning how to properly channel, developing your own language with spirit, and practicing. I still have some time to, I still have, I feel, a way to develop, but I'm on my way. I would say that it all started when I was a small child. I could always feel and sense things around me. Just energy. I just felt like if something, I could just feel things. Like it's just like if I didn't like something in a room, I wouldn't go in that room. It
Would it be
just
like energies from like other people or kind of energies in spaces? What are we talking about here?
Great question. It's more energies within spaces. Like if it was like I didn't want to go in the dining room, I just didn't like the energy in the dining room. No one would be in the dining room, but I don't want to go in there, or I'm not going to go in this room. Nope, no, thank you. I'm just not going to go there. Or I would hear like knockings and stuff when there would be no one there when I was younger. And, it kind of developed more and more as, I got older. I would have dreams with loved ones that have crossed over, which is something I frequently have now to this day. It's something that's regular for me. And just as I got older, it just developed into kind of more being able to see it more in waking life, just like know like the sense, this knowingness that there is the presence of someone else there. um and it's something that I ended up exploring with the help of friends who knew other people who were mediums, and just my own sort of research. And I did a really big deep dive into it, into learning more about it, and started taking classes and kind of doing practice with other people that I didn't know at all, reading them. And I really learned that there is a way to connect and with spirit in that way, and I'm learning the language now of that still to this day. um
I'm sorry, I'm going to interrupt you for a second. When you say spirit and you've used that word a few times, what do you mean by that?
Great, a question. Yeah, it's essentially it's my general term for the unseen, for kind of like the energy of those who have passed. It's a general term that I've heard other mediums used, and I've adopted it myself, especially one of my favorite mediums, Teresa Caputo, the Long Island medium. I That's another reason why I feel like I got into mediumship. I've been watching her shows since it came out back in 2002 or 3, whenever it was, like, and I really found her fascinating, and that just kind of helped cultivate also. I mean, I'm very different in my style of how I would do it. She's always turned on, but I think that's part of the act for the show that she does. But I found her very inspiring, and also kind of integrate a little bit of what she does, but not but at the same time different too.
So, for someone who doesn't really know anything about this, one could ask, why is this even important? Like, why would it matter to connect with the spirit or your loved ones? Why, Like, why even cultivate this skill? What are the benefits? What are the downsides? What do people get out of it?
So I feel like in general, it's all of us fear death. I really think the overwhelming majority of those of people, if you were to survey, the majority would say that they have a fear of death. And when you lose loved ones, you there I feel like it just feels like it can't be that final. And there has to be a way to connect. I've always rationalized that matter is not created or destroyed, it just changes form. So, with that kind of scientific principle and just the senses, what I've sensed around me, I've cultivated this kind of passion for learning more about how to connect with that energy that has now transformed into something else. And I feel like it helps us as people who are still, and as humans in body form, helps us feel a little bit more comfortable that in death, there is some form of survival of consciousness of those that we love. And also when we go, that we will be able to be there for those that are we leave behind on earth. So in essence, it feels like it's kind of creating this comfort for people. And for me, it does that as well. It all started, I think, really wanting to know more about that aspect also when I lost my grandmother in 2008. I feel like at that I remember after going to her funeral, I immediately went to a bookstore and I wanted to purchase books about near death experiences and stuff like that and learning about what happens when people go to the other side because I'm like, I feel like she's around. I'm like, this doesn't no, there's something more going on here. And that
She comes into your dreams quite
all the
frequently.
time. Oh my goodness, yeah. She's always around. My grandma always makes her presence known. She always makes her presence known, my grandmother. In my dreams, I'll get little signs from her. So yeah, I have a pretty strong connection with her, I feel, still to this day, even though she isn't around. Yeah.
So you've been doing all this research. You have experienced quite a bit with the energies you've sensed, connecting with your grandmother, connecting with other energies on the other side, quote unquote, I guess, or behind the veil, however you want to call it. What have you learned? What is your understanding of what happens after we die?
So like I'm going to put the caveat that my understanding is based upon what I've heard and what I've learned. And I feel like it's a, I feel like from one thing, first thing from what I've learned is that it seems like there are common themes to whatever you want to call it, crossing over, dying, passing. However, there are differences depending on a person's, from what I've seen and what I've hearing all these near death recounts and everything. Um, there's a difference in depending on what your mental state is. What is your relationship with religion, death? All that will kind of come into play what you kind of experience initially. I mean, it seems like the overarching theme is the bright light and welcome by loved ones or loving entities, is what I've read. And then a lot of the time I've also read that there is a period of that they say of rest, when there's a transitioning from the body that the soul goes through, of just like kind of rest. And I've heard from other accounts of mediums that have connected with loved ones that have passed over, almost as though the soul is kind of like lounging on a chase lounge for a while, just trying to recoup after having an earthly life, and then is kind of just present, just like in an ever presence. And from, and then there's ways that they can connect to their loved ones. Some find it easier than others. And that there's also I've done a lot of reading on this. There's some people that have said that there is like more learning when you're on the once you kind of cross over as energy. You can, there's many different roles or things that people do from what I've read. But the only way I will really know is when I die. I'll let you know. I'll report back.
Please do. Um, I mean, obviously you've done a lot of reading because I know you read a lot.
Hmm.
And just I think you also read like 5,000 books at the same time.
I do read a
Maybe I'm
lot.
exaggerating, maybe 4,000.
Maybe
Um,
4,000. Yeah.
so aside from reading, have you actually like experienced visitations from loved ones aside from your grandmother? Or like did your personal experience help you understand maybe how things are once a person dies?
So, yeah, I feel like a good example is that once our loved ones die, they are always watching and they're always there for this. And I can give a personal story of back in 2020, my grandfather started having a mental decline, and I was kind of worried about it. And I noticed it. I brought it up with my family. My mom's like, "Yeah, I'll take him to a neurologist or whatever." Kind of left it at that. Then, like a few months later in 2021, all of a sudden I'm washing dishes, like my after dinner, minding my own business. And I feel my grandfather's father, who passed away in 2003, running towards me, like, call your mother right now. Call your mom, like just running towards me. And he was like, kind of like I could feel him say, like, the urgency, something's wrong with your grandfather. So I immediately called my grandmother, and my grandma was like, "Yeah, your mother's taking your grandfather to the hospital. Meet her at the hospital." And it was the day we finally got a diagnosis for what was going on with him, and we were able to help him. And we were able to help him as best he can to live the last 2 years of his life as fully as he could with
That's
having that
incredible.
diagnosis.
I'm assuming that this is not the only time that this has happened to you, where you have like a download of a loved one saying something to you or you knowing something.
Yes, it has happened other times as well. This is the one that sticks out to me the most, but there definitely have been other times too where it's like, or, even, yeah, it's like downloads from loved ones or just even like nudges to be like, "Hey, I feel like you should just pray for this person and just check on them." And then I will, and it'll be like, yeah, like my friend will be having something major happening at that very moment, and they were scared for their life. This happened not too long ago with one of my friends. So, so I definitely do get these kind of moments and downloads and like let's check in, and it's loved ones that'll help me or just like little nudges within that'll kind of have me do that.
You've done that a few times with me when you would just check in on me and say, "Hey, kind of been thinking about you," or some other things. I mean, you and I talk very frequently
Yeah.
anyway, but I do remember a few episodes of where you've done that. And it felt like a nudge of like, "Hey, I feel like something is going on."
Yes. Yeah. And I tend to follow that. And I feel like, sometimes I can't recall like whether or not some of those were, if I want to call it quote unquote spirit led, or just like kind of gut led versus, something. But, um, there are definitely times where there have been where it is like a nudge from, we'll just use the general to continue use the general term spirit, where they're like, yeah, check on them. Something's going on.
So you are obviously listening to this in your day-to-day life. You're led by intuition. You're experiencing the spirit in various times. Has this ever happened at work? I mean, and if it has, how do you deal with it? I mean, I'm assuming you just can't turn off whatever happens in your brain or whoever's trying to contact you either way.
Yeah. I have had it happen a couple of times, definitely at work. One the most vivid was when I was resuscitating a child, adolescent child that ended up dying, and I remember clearly in the middle of a 6 hour resuscitation slash code, hearing just clearly like let me go, like it clear as day. I was like, whoa, like it felt like it was the voice of that child that said it, even though this child was intubated, compressions are happening, I'm actively running this code. Um, and I was like, whoa, okay. Like I remember it was myself and the ICU attending who I trained with. And I like looked at him. I'm like, did you hear that? And he was like, huh? So it's like, all right, well, I guess not. But usually it's like a moment like that. And I keep my nose to the ground and I keep doing what I'm doing. I keep on with my resuscitation or whatever I'm doing and then, process it later. But it happens from time to time, that being the most vivid, the most kind of like felt like real, like right there, um, but sometimes it'll happen with death that I'll sense presences after I lose a patient or whatever, and but
How often does it happen that you lose a patient at your job?
sure, I would say about twice a year. That because I work in a more now on average like twice a year because I'm working in a more community based setting. When I was at a major academic institution, it would be a little bit more frequent. Um, but it's probably about twice a year. And, like for me, yes, I can kind of sense the presence of the energy that could still be there lingering around. I try to like for me, the main focus when that happens is the family. It's just honoring the family at that time and trying to give them the space that they need at that time to kind of start the process of grief. I'm very in when I do my resuscitations codes, I make sure that I involve the family as much as they want to be involved. And I make sure that they are there, right, as much as I can. Like sometimes it annoys people, but I try to make sure that they are there when I call time of death. I feel that helps with closure for them too. Um, and I also make sure that I ask them what would they like. Is there a person that they like, sort of a pastor or minister or someone that they would like present? And, I make sure we have all the support we can give them. I check in on them several times, while in between patients and things like that. For me, it's just as important as when a person enters the world, when they exit the world, and making sure we start to take care of those that are kind of left behind. And I try to do that. And I feel like in the work that I've done in learning more about grief and mediumship and everything like that, it feels like extra important because I see how much people suffer when they lose loved ones. And I've experienced it myself to a certain extent as well when I've lost loved ones. So it's just helped me to learn how to help them honor the life that is gone and help them with any support I can give them through this extremely tough transition for them.
I can't even imagine what it's like to be a parent whose child is dying. It's unimaginable. It's just utterly heartbreaking. Your job is so difficult. Do you feel that there is some sort of a difference between helping a child pass or doing your best to resuscitate them, but also allow them the grace of dying in a way that is dignified versus adults? Is there any difference between how things are handled with children versus adults?
I feel like with everything with children, you're not just treating the child, you're treating the family,
Hmm.
with everything with children. Like with adults, yes, you could say that to a certain extent, depending, like if it's an elderly person and their children are highly involved or whatever the case may be, spouses. But there's something a little bit different about children. Like their recovery is dependent on their guardians, parents, and things like that. So, um, and there is such a kind of symbiotic relationship between parents and children. It's different. Not to say that, there's not a closeness between spouses or, like adult children and parents, but the young child and the parent, there's an attachment there that is different, that there is a big reliance that the child has on the parent, and also vice versa. Because parents, a lot of time, parents' well-being, they'll feel like they're good when their children are good. So in doing that, I feel like the difference is you really want to make sure you involve the parents at the end of life. You want to show that you show the utmost respect and care for the child, as if you do know that there is nothing else that can be done, and unfortunately that child is going to die in that moment or is dead and you're about to say they are dead. um I really try to do that. And one thing that's beautiful that we did at our last resuscitation, that I want to start doing moving forward, and I can't take credit for this. This was the social worker that I worked with. We took a moment of silence to honor the life of the child who just passed, and being able to do that. And I just kind of, because I'm always at the foot of the bed because I'm running the show. So I always kind of like put my hand on their feet and gently, like, will bow my head in reverence for that child's life. But now I'm going to make sure that I do that as well, and make sure to do that in front of the parents. But I think it's important to do that and to honor that, and also to use their name, say their name. I
Hmm.
think that's important for adults too. And sometimes it's hard because patients come in, we have very little information, especially if it's someone that's found on the street or something like that. But um, it's extremely important to provide that and to do whatever you can to provide as much closure, and reassurance to the parents. No matter what, they're always going to feel like they did something wrong. I feel like it's a natural thing, but that nothing else could be done at that moment. Like everything that could be done was done. And it almost feels like a little bit of a show, but I feel like it needs to be verbalized. And I always do. Is there anything else that anyone can think of that we can do that we haven't tried yet? And I need at least 2 no's. And if once I get multiple no's, then I know, okay, I can call time of death.
And why do you think that's important to hear those no's, to hear yes, to hear those no's?
I feel like it's important because it allows you to kind of allows your mind or your subconscious to process that at that moment nothing else could be done in order to stop your child from dying. Like it's something subconscious. Hearing it out loud, I feel like provides some sort of messaging that everything that could be done was possibly done at that time. And it's not like, obviously, it's not like going to stop the flood that is grief or anything, but it can help provide maybe 1% of reassurance that everything was done at that time that could be done.
Has it ever happened yet that someone said, "Yes, I can think of this to do"?
No, it hasn't actually. But if it would, that would be amazing and I would take it, like I try everything. I make sure, we're not I leave no stone unturned. And I make sure I've been very fortunate that I've been surrounded by so many brilliant minds that can always think of all these different things that we technically could be missing. Maybe it's a zebra, but you never know. Like we'll throw those Hail Mary passes if we have to in order to try to bring kids back. So I it hasn't happened yet, but if it does, oh my goodness, you bet your bottom dollar I'm gonna try that. I'm gonna do it.
But it sounds like when you ask the question of if anyone can think of anything else, it
Mhm.
is only asked after everyone already gave all of their opinions and the zebras and everything else that could possibly be out there. It's almost like the last question that you ask just in case.
So it's actually I asked throughout the resuscitation any other ideas,
Okay.
suggestions. We've given, Rosefin, we're treating XYZ. Anyone think that like intralipids, if this is a tox case, would be good. You know what I mean? Like I'm constantly doing that. I try to run my ideas by the team as I go through. Do you have any other ideas? But I intentionally say it one last time before I close the resuscitation.
So it feels like you're in some ways becoming an expert at dying and death. Like it feels like from a young age you had this leaning towards the energies that connect the living and the dead. And then currently you're expanding on them as well. And also you touch upon it in your career. I mean, in my career, thankfully, I unfortunately also have had a few deaths of patients, but it is a bit more remote than when a child or a patient comes in and you're actively working on trying to save their life and they die. Um, there is a bit of a more active, present experience of death that happens in the moment than what I had to deal with in my career as a psychiatrist. It I just find it fascinating that this is the world that you're in, and your spiritual side, your ability to connect with death is also helping you to respect and um respect and also provide comfort for the families as it is happening real time.
Yeah, I mean, I feel like for sure it has been. And I feel like you can even expand that to grief in general. I mean, in both our work, we both deal with grief a lot. I feel like this kind of the the way I've learned to kind of help manage families with grief also kind of goes into the grief of a challenging diagnosis. Like if, unfortunately, I've had multiple children that I've found that had some form of cancer that now I need to kind of let the family know that this is what's going on, or it's kind of helped me to help ease them into hearing this bad news as well, what is
Mm.
considered bad news. um I feel like it's really helped me touch into that, into those soft skills that are very hard to, or challenging I should say, to kind of navigate in real time.
I think it's very interesting that they're called soft skills and yet they're so hard. I mean, you obviously are able to train how to intubate, how to do a lot of procedures that you have to do in your work day to day. And of course those are not easy. Um but yet it feels like the soft skills can sometimes be harder because they're so nuanced. You have to really tap into the vulnerability in yourself and others and be able to sit in this heaviness of the moment, which I can't even imagine how hard it is. I mean, you deal with grief in very real time, like acute grief, a grief that happens right after a loved one dies. I get to see that grief maybe a little bit later after there is a bit of processing. But for you, you see it right there and then, very live. And that's incredibly difficult. How do you manage with the difficulty of it? How do you sit with that hardship and vulnerability when it happens?
So I feel there's a few things I do. One thing I really love to do is after a difficult case is I really find value in debriefing. Not only to kind of see what we could do better as a team or what like little small systems based things can be changed. So maybe the next patient could have something a little bit better, but also to work through as collectively as a group that all had this same shared difficult experience, the feelings that we're having at that moment. And hearing about that and just seeing where everyone is with that. And then, like for myself, I'll process that also through my meditation and also movement through yoga and with my therapist as well. I kind of allow myself to move through what I'm feeling with the grief that I may have, and just learning how to and just process it, or discussing it with my amazing husband who will listen to me about all these difficult cases, or my mother who has the same background. um, it really helps me to kind of process these difficult emotions.
Since you sense energies, do these energies come home with you? How do you boundary yourself with the heaviness of some of these energies?
So from work, I always try to for like the boundaries of work, it's like, cause I carry all that comes that day, like the stress of parents for like, they're very worried about their kids. So I carry that stress, or like the worry, are we missing anything? Are we doing everything? That all comes with me. That's all energy that does come back with me. So what I like to do is I will bathe from head to toe as soon as I get home to get it all off me, get it all away. And also hygienically too, because, I'm surrounded by all these different pathogens, if you will, all these different infectious sources that are all over me, and they're kids, and kids are very loving and cuddly and snotty and wonderful. But, some of these sick kids will just can't help but want to just jump on me and give me a hug and things like that. So for that reason, and also just like it's like a kind of like almost like a ritual for me. It's like I get home, I shower, it's all off me, and I move on with my day.
I still remember some of the photos you sent me during COVID time where you would just have multi layers of protection that you went to work with. Well, you went to work and then you put those layers of
Yeah.
protection.
Oh yeah. Oh
I
yeah.
remember you telling me you would come home and you would change in the garage, or you would change somewhere so that you don't bring all those cooties back inside.
Yeah, I was at that during the time of COVID. We lived in like essentially like a town. It was like a row house is a better word for it, in Queens. And we had a downstairs bathroom. So
I was
I would
back.
go directly to the downstairs bathroom, which was right next to was shared with our laundry. And I would shower there and throw the clothes directly in the laundry so I didn't expose, you know, my husband or my daughter to the germs.
You're such a superwoman. I mean, you were working in a hospital during COVID. How was that experience for you?
So, being that I was pediatric emergency and being that I was pregnant during the time of COVID, I did not experience firsthand the same sort of experience that all my adult emergency medicine docs, like colleagues, experienced, and some of my PEM colleagues experienced, who ended up taking care of adults with COVID. My experience was
When you say
that
PEM, what do you mean by that?
peds emergency medicine. So
Thank you.
my other peds emergency medicine colleagues, PEM colleagues, because I was pregnant, I was asked to take care of adults, but I opted to not do that because I was very concerned about, being pregnant and the risks associated with contracting COVID with being pregnant. So I was fortunate that I was able to do a lot of telehealth at that time, where I would do telehealth visits with adults and children. And I would work in the peds ER too, some shifts, but those shifts were essentially very light because not a lot of people were bringing their children to the emergency department. There was a big urging to stay home. So um, it was very different. I just do remember passing through the adult side and just seeing how inundated they were, hearing the multiple code blues overhead, seeing being at the hospital across the street from Central Park and seeing Central Park filled with hospital beds. Living in very close proximity to a hospital and across the street from the nursing home, and hearing ambulance after ambulance, seeing the large trucks that were turned into morgues. I had that kind of experience, which is a little bit more of an outsider experience, I would say, than a true experience as my other adult colleagues and pediatric colleagues that worked with adults at that time did. So it was a little different. Still scary, but
Hmm.
I can't I'm so amazed by my colleagues' bravery for all they did to help all these people who were sick, dying, really putting their own lives out there to save the lives of all these people who were suffering from COVID. They are amazing, and I think they deserve so much for all that they have sacrificed during that very difficult time. But I was not one of them. I do not put myself in that category.
Piggybacking off of COVID and the controversy that it caused regarding how it was handled, vaccinations, and then bringing this to a current world where there is a lot of doubt about vaccines in children and how they're vaccinated and the schedule of vaccinations and the current administration and how it views the scheduled vaccines. Do you have thoughts as a pediatric emergency doctor about all of the stuff that's going on?
Yes, I do. I just want to start by saying I love vaccines. Vaccines are the bomb. I recommend vaccines. Not too long ago, I will say, in my recent past, within the past week, I've dealt with a very sick child that was grossly under immunized, that I feel like the illness could have been prevented if the vaccines were received.
Hmm.
So from my perspective, I mean, I will say, I don't see it that often, but I do see it. And I've seen a resurgence of, within the past year, of some communicable diseases that were, not as common because of the under vaccination or non vaccination of children. And there is real risk associated with it. So I do see value in receiving the vaccines that have been studied rigorously, and that we know there is a mild, like me, there is a side effect profile that is more on the mild side. And I do have pause about certain vaccines with certain populations. Like, for example, with the COVID vaccine, I have my own sort of reservations with giving it to my children. And that's a personal choice based upon our family history and what the vaccine has been known to do with thrombosis. So I just personally just choose to keep my children away from that vaccine, but I would get it because I feel like I'm more exposed to it than they are, one, and I don't carry the same risks that they do. Um,
So it kind of sounds like you're making this decision not based of just being anti-vaccine, but more so the pros and the cons of that particular vaccine with your medical history in the family and also your kids' ages. Would that be correct? to say?
Yeah, not with yes, yes, with their ages based on their exposures. Yes, I would say yes. That is correct. That is correct. But for me, the scheduled vaccines that are there for a reason, and not only do they keep the children who receive them safe, but I also think about all these poor children that have chronic illnesses, or leukemia that can't receive these vaccines. And if they do get sick with these illnesses, they have a higher risk of mortality. There's something to be said about the herd immunity and keeping these diseases away from children who just can't receive the vaccines, who still might be exposed to them. And I feel like we're doing these children a great disservice by kind of deciding to not continue with the vaccines.
And you're a physician and you're able to read a lot of data, you're able to process a lot of information that a common person without medical education can't. So for someone who has a lot of doubt, who is listening to different things and doesn't really know what to make of the information, whether to get a vaccine or not to get a vaccine, what do you usually recommend? I'm sure you've had some parents who may have come in and have been hesitant about whether to get a particular treatment or not that may be highly recommended. How do you deal with parents who are hesitant?
So it depends. Like, I don't really deal with vaccines. But what I deal with, is like head trauma.
Hmm.
That's something I deal with all the time. Kids are constantly hitting their head, especially little ones. So a lot of parents will come in wanting a CAT scan right away. And they're like, I need a diagnosis of concussion with a CAT scan. That's just like something I hear all the time with that level of anxiety. And there are guidelines. This has been probably one of the most studied things within pediatric emergency medicine that we have, PCARN head trauma rules. Like what I like to do is I walk with them through the evidence. I will pull up the guidelines and I have no problem showing them that there are multiple sources. There are a lot of these guidelines are on MD Calc, and I'll be like, okay, let's walk through this with your child. This is your child's age. We'll put this data, we'll put this. Well, this is what the evidence shows. And this is why we don't need to do the CAT scan right now. And this is, so like I tend to do that. Whether a lot of it usually has to do with imaging more than anything else. That's like probably the biggest hesitancy, whether it's they really want imaging and they don't need it, and it's a higher risk of, having their child develop solid organ uh, tumors down the line, trying to prevent that. Or if I've had the opposite where a child looks like there is a skull fracture or something and they're very anti, and it's like, well, I mean, if I don't know if this is going on, your child could die. And, I'll go through the evidence and I'll be very blunt with them that if this is left untreated, this can have a poor outcome.
So sounds like you educate the parents to the
Yes.
best of your ability regarding what the pros and the cons are of any suggestion that you basically make to the parents about the kid's treatment.
Yes. That's it. That's exactly right.
So going forward, do you feel like the current schedule for vaccines is a well-studied and recommended way of doing things, or do you feel like there is some room for possible more research or changing things? Where do you think our research is regarding the current vaccination schedule for children?
So, I can from what my experience is as a pediatric emergency doctor and what I see with my children when they're getting the vaccines now is what I can use on my experience, like for my experience. And I'm speaking from a very like tunnel, this is my world, this is what I'm used to. So but I feel like the current schedule is fine as is, and it protects children, as they need it. And, I know that I've heard so many people say that they're concerned about autism and all these different concerns that there has been research out there that debunks it, but there's still the lingering concern. Um, a lot of the vaccines too, like there's concern about whether we're giving them heavy metal poisoning and things like that, but that has also been debunked with research that that is not the case. Um, so I personally feel that the vaccines schedule as is fine. And this is from my experience, what I know about the literature, and just what I've seen when the vaccine schedule isn't followed.
Hmm. Have you seen patients come in with side effects of vaccines in your emergency room?
Yes,
What kind
rarely.
of side effects can they have?
I mean, it depends. I've only seen one in recent memory that a patient received vaccines and started to get facial swelling. Um, but there have been other reports of neurologic kind of complications, which I've never seen. Guillain-Barré has been, caused by certain vaccines. That have been reported to the adverse event database for vaccines, things like that. But, in I would say the 15 years that I've been seeing children since the start of my pediatric residency to now, I haven't really seen many complications outside of fever.
Mhm.
I've
Which is
seen
mild, I
fever.
guess, and transient.
Correct. Yeah.
We are coming up and to an end of our wonderful episode, and I would like to do my favorite lightning round with you.
Let's go.
You ready?
I'm ready. Let's go.
All right. Question number 1. Oracle cards or crystals? You only get to keep one. Which is it?
My God, it's like asking me which child I could keep. um, I guess I'm gonna have to go with my oracle cards, but it's really hard. It's like the hardest decision I feel like I've ever made in my whole life. But yeah, I'm gonna have to go oracle cards.
Wow, that says a lot. So why oracle cards?
Just like there's something about the guidance that I get from like my oracle cards. One thing I also do that I forgot to mention is that I will pull an oracle card before journaling and kind of use
Hmm,
that to kind of focus in on my journaling. So for me, I feel like there's so much wisdom in the cards. So I would probably have a harder time letting go of those before crystals.
fair. If you could prescribe one non-medical thing for every patient, what would it be?
Hydration. Drink water.
Wow.
Please, everybody, drink water. I feel like nobody drinks enough water. I feel like it's so important and it helps with mental clarity. It helps with sleep. It helps with everything. Skin. Like, I mean, I'm a like nut about drinking water. I drink anywhere between 11 to 15 glasses of water a day.
Holy
So,
moly, how?
yes, I just do it.
Well, okay, so for someone like me who has trouble hydrating, I'm like a freaking camel here. What are your suggestions on how to hydrate more throughout the day?
Force yourself by having a very large thermos near you, cup. Like I have a very large 40-ounce real fake Stanley that I have that I drink water from daily. Like I'll have two of those probably by like 1 o'clock, and then have maybe one more of those in the evening, or a smaller bottle of water in the evening. Or at work, like before I go to work, I'll drink 1 liter of water. I'm very intentional. I'll drink a liter of water before I get to work. And then when I get to work, I'll have another like 2 other 20 ounces of water and then a little more before because I bring a smaller, like an actual Stanley that I have that I bring to work. I'm very intentional about it. And I make sure that I have it like before noon and then with lunch and then the afternoon I'll have it and another one in the evening. So I'm very intentional
Respect.
and I think it's extremely important.
Okay, so do your bottles have glitter or sparkles on them?
Well, I feel like singing the Boys to Men, It's So Hard to Say Goodbye to Yesterday because my favorite 40-ounce bottle was this purple sparkly one that I have that it broke when I was exercising. So, yeah, I did, but now I no longer have it. Then I'll take with me
The
the
reason I
memories
asked this
forever.
let it rest in peace.
Yes.
The reason I asked Michelle about this is because she is a fan of sparkle. She is glamorous in every way, and I love it. All right, moving on to the third question. If you could give one medical advice to everyone, what would it be? Hydrate
Medical,
too?
I mean, it's like sleep.
Ooh,
Sleep. Sleep is so important. We all need to sleep. I feel like that's a sound piece of medical advice because it really helps with cardiovascular health, neurologic, everything. Like, there is nothing more important than doing your best to have good sleep hygiene and sleeping according to your body's needs. Like, trying your best to do that will make you your best self in every way, shape, and form.
love it. Do you sense more energy in abandoned places or crowded hospitals?
It's about the same, I would say. I think sometimes it depends. Like, it depends on the day. I would say it really does. Like, energy's energy is energy, and it's going to be there no matter what. Um, so I would say about the same.
Okay. If you could have a conversation with any loved one who is deceased, who would it be and why?
Um, of course, my grandfather, because I love talking with him and I miss him, and he was just so much fun, and he was like my world. So.
Do you have an idea what you would want to talk to him about?
Just wanna see if he, like, knows how the kids are doing, how Antonio and Layla are growing up, and sees all that we're doing and, how much we love him and how we try to honor him and see how he's doing now, like, I used to joke around with him when I was, 'cause I just love to kid around and love to use songs in my kidding around. He couldn't see, so I used to sing to him the song from Yentl, "Papa, can you hear me? Papa, can you see me?" So, I just, I wonder now, can he see? Can he see everything going on? Which he probably can, but just like how is the experience now compared to the experience down here? Yeah.
Have you been connecting with him since he had died?
Yes. I feel like I have, and I feel like he's present and he makes his presence known. Like, if we're all together, like the family, I remember one time specifically we're all together and like the light in the kitchen just went brighter and brighter and brighter and then went back to normal. I'm like, oh, he's here. He's, hanging out with us. So definitely I felt his presence and connected to him in different ways.
That's really beautiful. I hear that a lot from people, and I've experienced it myself when there is some weird technological or light type um, interference that can signal that a loved one or some kind of a spirit is near. And it has definitely happened to me a few times where it was just too weird and too odd to explain otherwise. Of course, totally unscientific,
100%.
but it feels like it has some meaning to it.
Absolutely. And, like it's happened to me with other things. Like I'll be talking to my, I remember one time I was talking to my grandmother about her father. And all of a sudden, my phone, I had no alarms set, nothing. All of a sudden, it started alarming like crazy. Like one of my alarms went off for no reason at all. That wasn't set. And I was like, look. And I was, my brother was there too. He's like freaking out. And my grandma starts screaming because that's just her MO. And, like things like that happen. And a great recommendation for a book, if anyone is interested in learning more about signs, is the book Signs by the medium Laura Lynn Jackson. It's a really great book that explains it. It's a New York Times bestseller and a really easy and nice read.
Thank you for that recommendation. I actually have to look that up myself. Don't think I've even heard of her.
Yeah, her book, those she has two books, and that book is really great. And she's a really world renowned medium and coming out with another book too soon.
Well, since we are talking about books, do you have any other books or readings that you may recommend for people if they are interested in finding out more about tapping into their ability to connect with their loved ones or anything about death and dying?
So, for Death and Dying, one of my favorite books is The Wheel of Life by Elizabeth Kubler Ross. I think her
Like,
works are incredible, and the deep dive that she did into dying and death is incredible and really worth reading. Also, I think I can't help but mention Many Lives, Many Masters by Brian Weiss, Dr. Brian Weiss. I feel like that book is amazing, even though it necessarily doesn't have to do with death. But Past Life Regressions, I think that is a really good book and kind of exploring that kind of avenue of spirituality and connecting to something more than what's tangible here. Um, and, Signs, I think Signs, the one by Laura Lynn Jackson, are good places to start. And then kind of follow your journey and see where it takes you.
speaking of following your journey, where do you think your journey is going and where will it take you?
I think my journey is here, present, in the now. I have a beautiful life right now where I have my awesome family, my amazing husband, and two beautiful children, and our little life here down in South Florida where, it's pretty balanced where I'm working my shifts. I teach, whether it's on shift when I do have residents working with me, or I teach them out in the classroom setting, or teaching other residency programs, like kind of focusing on that medical education piece and probably focusing on physician wellness a little bit. I am probably going to do training, formal training in peer to peer counseling through the ASEP Physician Wellness Committee that I am part of. So we'll see where that develops. And, if any, we'll see where the road brings me. And I'm open to seeing where life brings me. I'm enjoying what I'm doing right now. And I'm very grateful for the life I have right now. And yeah, we'll see.
Good luck with all of this journeying. I, of course, will keep uh, being in the loop of all of it since you and I talk a lot. And perhaps down the line, if you will be up to it, we can have you back on the podcast and update us in your journey and your development and maybe some other questions we have regarding pediatrics that I'm sure will come up as time goes on. Um, but I just want to thank you for being on this episode. It really means a lot to me that you're here. I've been really looking forward to having you on the show. It gives me this feeling of warmth and love that I have such an amazing friend who is brilliant in various ways. And I'm really truly honored to have you as my friend, but also be willing to do this episode with me.
Thank you so much for your beautiful, amazing sentiment and words. It's been felt. And ditto, I have to say to you, ditto. And I would love to come back. And thank you so much for having me on the show.
Thank you for tuning in and listening. If you enjoyed this episode, please subscribe, leave a review, and share the Quantum Couch with someone you think might love this space too. If you would like to reach out, you can email me at thequantumcouch@gmail.com. You can also follow me on Instagram and Facebook. Just search for The Quantum Couch. Thank you for listening. Until next time. I'm Dr. Icahn Conboy. Take good care, stay curious, and keep exploring. The information in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Listening to this podcast does not create a physician-patient relationship with Dr. Icahn Conboy or any guest on this podcast. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.